My name is Ulla Werlauff and I'm a physiotherapist and PhD, and I work at the Danish National Rehabilitation Centre for Neuromuscular Diseases in Denmark. And as a national centre, we register all persons with a spinal muscular atrophy. So we have the total population of SMA in Denmark. SMA, as you know, there have been a lot of progress in the past with more medical treatments available. And in Denmark, until summer 23, the treatment was available for all children up till 10 years old. But in the late 22, it was discussed whether this should be extended to another group, to older patients, to young patients, and perhaps also to adult patients. And that was a time where we thought that if this treatment was approved, we had to had a baseline evaluation of our population with SMA. So we thought about how could we do that. And it was quite clear that we did not know the target group. We did not know would it be 10 persons or would it be 100 persons who would have the treatment, or when would it come. And it was also clear that we could not have a physical assessment of so many patients. We couldn't just do that. We have a clinic to run and we're busy in that. So we decided that we would concentrate on the non-ambulant population, that is persons with SMA2, because we have an evaluation form, outcome measure, who is international used, called the EK2 scale. It's a scale that is developed for non-ambulant patients with Duchenne and with SMA, and that registers many things, not only motor function, but also balance and how to eat and how to swallow. And it has proven to be quite sensitive for a very weak population. And this is indeed, or has been, the difficulties in evaluating elder patients with SMA2, because they have so very little muscle strength, and the outcome measures cannot really measure anything, nor if there are any progress. So we decided to do an online examination and use the EK2 scale as a primary outcome measure. We would also use the fatigue severity scale, as fatigue has been addressed as a huge problem in this population. So we would like to see if the medication had any effect on that. So we started to invite all our patients, non-ambulant patients, that was around 117 patients, to an online evaluation. We knew from earlier that the EK2 scale is quite okay to evaluate online, because most of it is performed as an interview. So that was great. And from the persons invited, there was 59 persons who accepted, and they were from 11 years old, 11, 12 years old, and up till 78, I think. So that was a quite huge population, or a broad population, but 59 accepted the invitation. And we did so that it was physios and OTs, occupational therapists, who performed the online examination. Because we have rules in Denmark that you must have some motor function to be available for medical treatment, we used two entry items from the room scale. The room evaluate hand function and motor function. And we knew that the Danish Medical Council had said that you must be able to score at least 2 points on the room scale to be available for medical treatment. So we did that as a start, and then we evaluated with the EK2 scale. And that scale has 17 items with a 4 scoring possibility on each item. You can score 0, that's the best score, or you can score 3, which is in the other end of the scale. The scale is counted as a composite score in the end. And we did that with the patients, and also we asked the patients, if medical treatment is available, what do you hope and what do you expect from the treatment? And very many patients said that they hope for stabilization. Also, quite a few said, well, they hope for improvement, but it was surprisingly that so many hope for stabilization to keep their function where it is at the moment. Then we also said that to be part of this study, they were asked if medical treatment was an option, we would evaluate any effect half a year after beginning the medical treatment. It ended up that in summer 23, medical treatment was approved for persons up till 25 years of age. And in that group, we only had 9 patients who had accepted the invitations. So those 9 patients were evaluated 6 months after having the treatment, and then we compared the scores before and after medical treatment. And for the EK2 scale, there was no difference. There wasn't any deterioration, but there wasn't any improvement from the scales. But we could see from our assessment that there was some movement in the scale, that the score was a little more spread than it had been before. And that was also the case for the fatigue severity scale. There was no significant difference, but there was a little more widespread distribution of the scores. So, and by the interviews, 7 out of 9 said that their expectations has been met, and that was either that they had an improvement or that they didn't have a deterioration. 2 said it had not been met. They didn't feel that they had improved or stabilized as they had hoped for. So for now, we can say, to sum it up, what have we learned from that? We have certainly learned that it is possible to evaluate by digital measurement, and it's an easy way to say, well, we mustn't let this moment go. We must be there prepared to have a baseline examination and to follow up afterwards. And then it has been the case that this August, the Danish Medical Council has approved the medical treatment for all adults. So if they can fulfill the 2 points requirement for motor function, and they do not have ventilatory support more than 16 hours a day, but then they can have the treatment. So now we probably will follow up on the other part of the persons who will have the treatment now. So we'll see 6 months after they have begun the treatment, and then I think we'll include the younger population as well to see, well, has something changed 1 year after or 1.5 years after, because we learn from so many of the studies that there may be a long-term effect, that to evaluate something over a short period may not tell the truth. So we'll follow up on this. I think because it is a small world with neuromuscular diseases, because there are so many different neuromuscular diseases, and each of them are very rare diseases, but together, if you pool them, and so many things are about the same, if you measure, it's not that rare anymore. And there are some very good websites. You know, there is TreatNMD has a pod NMD for therapists, where you can read about the various diseases. You can also read about the outcome measures to use. You can have a look at some videos. You can also read about the EK2 scale there, and also TreatNMD, of course, have some masterclass, digitally online masterclass, or where you can take a course and learn about the diseases. So I would strongly advise that you use the fora that already are available. And I think the neuromuscular world is very open for questions. So don't be shy to ask your questions. Go to a physio who knows something about it, and she probably can tell you where to look and where to go.